There are two types of hearing loss. We have conductive and sensory neural. Again, conductive and sensory neural. When we say conductive hearing loss, it's usually caused by an obstruction. Obstruction can be mechanical obstruction, like say a foreign body, for instance. Let's say there's a bug that got into your ear, or you got dirt into your ear, or you got just really big wax. Okay, you have a big ball of wax stuck in your ear. Or as Sasha's mentioning, it could be caused by an infection. Because if there's an infection inside your ear, what will an infection cause? Swelling, right? Swelling, inflammation. So will it still obstruct? Yes, so it will still obstruct airwaves. So of course, any mechanical or functional obstruction, so mechanical again would be any foreign body, or if it's functional obstruction, that means there's any swelling or any, let's say you have a growing tumor in there, so that anything that will cause obstruction in your ear canal leads to conductive hearing loss, which means can the airwaves, the sound waves, can they still be conducted into your inner ear? No more, leading to hearing loss. Now, sensory neural hearing loss is different. This is now caused by damage to that or into the auditory nerve itself. Again, sensory neural is actual damage or trauma to the actual structures in your inner ear, even including your auditory nerve. Give me examples of, so here's conductive. This is conductive hearing loss, and you have examples there. Sensory neural would be caused by, can this be caused by antibiotics? Yeah. Yes. Can this be caused by chemicals? Can this be caused by your type of work? Let's say you're a airplane engineer. Yeah. Yes. Okay. So any let's say you work, you're a sound engineer. Okay. So you work with concerts all the time. You have concerts. You're on a tour. Okay. So you're a sound engineer for a, let's say it's Matchbox 20. Okay. So they have a tour for, let's say, 6 months. Okay. And they have shows every other night. So with no ear protection, can you have sensory neural hearing loss? Yes, exposure to that much decibels. Okay, yeah, that can over time cause hearing loss. So what type again is that? Sensory neural. Okay, so that's actual damage to the cochlea or the vestibulocochlear nerve or the auditory nerve. Manifestations, of course. How do you know someone's deaf? What else? Very good. Correct. What else? How do they behave? You talk to them and what do they say? What do they say? What? Yeah, what? What? Asking you to repeat yourself, right? Or they respond a different way, right? They mishear your they misconstrue what you're saying. Okay, they hear something else, or they think they heard something, they interpreted it differently. Right. So here are the examples there is laid out in these two paragraphs. Prevention, of course, you look at the causes. So how can you prevent hearing loss? Okay, ear protection for sensory neural. What about for conductive hearing loss? Okay, so how do we clean our ears? Should we be doing that? No. Okay. So either use a you should go to a professional, really. You should go to an ENT professional, and then they have to do it for you. But of course, none of us do that. We just get a dollar pack of Q-tips that may or may not have cotton, right? So here are some risk factors. Let's go straight to the nursing intervention. So What's the purpose of our hearing? Why are we given the sense of hearing? So what's it for? To enjoy life? Well, how else? Yeah, you enjoy life, you can communicate, and also for, let's say there's a big truck coming. Okay, just like your sight, so our senses are basically for safety. And then of course there's the enjoyment, right? That you can listen to the orchestra, for instance, you can go watch your favorite show on Broadway or watch a concert. Okay, so for it's for pleasure. So here are your interventions when working with people who cannot hear or at least have hearing impairment. I won't read it for you. So these are suggestions or recommendations on how to communicate, facilitate communication with people with hearing loss. All right. So can I copy and paste this? All right. So how should you face the patient when talking? Talk behind their back? Okay. In a dark room? Okay. Would I just talk or can I use gestures? Can I use my hands? Like Italian? Okay. All right. So all the recommendations are there. All right. Or amplifiers. Here is the most common cause of conductive hearing loss, cerumen impaction. So this again should be done by a professional. Okay, so the removal of the wax. Here is the irrigation. So sometimes, not often, sometimes the patient may get an order for ear irrigation. So this is the method. So irrigation means you use a syringe and then you literally irrigate the ear. Okay, what's the temperature of the water? Okay, warm, not cold, not ice cold, not too hot. Okay. Foreign bodies, who has had an ant enter their ear? Yeah, that happened to me once. I couldn't sleep. Mhm. Uh-huh. And we could not get it out. I can hear what that thing was saying all night. It said, and there's absolutely nothing I could do. Okay? I could not get it out. Huh? My brother did the surgery. He when he got it out, I did not kill the ant. I tortured it. I kept it alive for a week. I ripped off a limb one day at a time. I wanted it to feel what I was feeling that night. Imagine you're 6 years old and you get that.
Just like if the kid could have something in their ears too, but
No, that ant was different. If I had no, it wasn't my fault. It's okay if it was my fault, but this ant had no business in my ear. Never forget that. Okay, so when we have surgery, we'll get to the chart soon. So here are some of the interventions on, this is now post-op. So were you allowed to get the operative eye wet? So same thing here. Can you get the operative ear wet? No. Should you put a plug there to catch the drainage? Yes, that would be applied by the physician. Can I go swimming? Can I go on an airplane? Okay. Can I go up a mountain? Okay, so avoid loss of pressure, right? Because that will increase intra-auditory pressure. So here, so swimming, all right, but don't worry, there's an actual, oh, here it is. I think this is the chart. Let me see. I'm not sure. This will be included, but this is not complete though. This is just for otitis externa, meaning infection of the middle ear. But this will be included, right? So ear protection, don't get it wet. Okay, but it's not complete. So here's one ear surgery, tympanoplasty. So one post-op care, again, similar. Do not get the ear wet. So that means no swimming. Can I go on the bathtub? Am I submerged when I'm in the bathtub? Oh, my head is up, right? I can't go on bathtub. Can I take a shower?
Just not wet your hair.
But not wet my hair. Okay, so makes sense, right? Okay, so yeah, you can take a shower or bath, but do not wet your head. Because of course, once your head is wet, it will run into your ears. It always runs into your ear.
Recommend for cotton balls?
Or you can wear a shower cap. Shower cap, so keeps your hair dry, so it will keep your ear dry. They soak, I mean, they absorb water also, so it wouldn't help.
The plus.
Okay. So here's another, I'm sorry, my mistake. There's no one chart. They're all scattered. So here's another one. So we know not to get it wet. What are the other limitations? So here, the incision heals within about 3 days. So therefore, what can we do? Or what must be avoided? Okay, so water. Right. And what about the activities we also avoided with eye surgery? Will it apply also?
Yeah.
Because where is your ear? In the same skull. Okay. Okay, here's a video on eardrop administration. Who has ever given eardrops? Okay. Make sure you know the actual procedure. It should be here somewhere. Probably in a different chapter. No, it should be the same chapter, but earlier in the chapter. I think it's somewhere. I'll show you. Earlier pages. It's probably here. It should say administration of eardrops. Maybe it's later. All right. Let's go to where were we with the surgical? Make sure you cover the we did this already. Yeah, we did the Myringotomy. This one doesn't have surgery. Okay. We did tympanoplasty. Oh, okay, there is a chart. Chart 59-7, page 1951. This is self-care after ear surgery. Now, this one specific middle ear or mastoid, but just like cataract surgery, will this apply to any ear manipulation? Does this apply to any ear surgery? Simple yes or no?
Yes.
Yes. Okay. So same thing. Say here. Why can't I blow my nose?
Pressure.
Okay, increasing pressure. Sneezing and coughing, any different from the eye? Same. Okay, lifting, same. Okay. So here again, avoid getting water into the operative ear. Let's go now to the inner ear problems. Let's go to Meniere's. I think we'll start with vertigo first, because vertigo is vertigo, motion sickness. This is referring to the same thing. So let's start here. Who has motion sickness here? With any vehicle?
Just both.
What about roller coasters? No. That's weird though. Okay.
Maybe I do a little, but I like them, so I'll get on them.
So motion sickness, we know you get vomiting, right? Okay, so but let's look at the process, because vomiting is just one of the symptoms. The complete symptoms are sweating, right? Don't you get sweaty?
Yeah.
Yeah, and then you turn pale, right? And then you get nauseous and start vomiting, and then your world keeps turning round and round. That's vertigo now. Okay. Interventions. We do have motion sickness medications. So we have meclizine or scopolamine, which is a patch you put behind the ear. So for these things to work, you have to take them at least 4 hours before any exposure to, in your case, riding the boat. Okay. Or so let's say other drugs, let's say Dramamine, for instance. The instructions say 1 to 2 hours, right? Okay, so just follow directions on the specific medication. Okay, so let's go to that one now. Okay, so that just describes Meniere's disease. Okay, so Meniere's disease is a trio of symptoms. Now, this is a chronic condition. The patient has Meniere's, typically they have it forever. So the manifestations, there are 3 common manifestations. One is vertigo. This alone is debilitating, right? Imagine your world spinning constantly. And with that comes what? The sweating, the pallor, the nausea, the vomiting, the headache, correct? So when we say vertigo, vertigo itself is a full set of manifestations, okay? Unpleasant manifestations. Second is there is tinnitus. What is tinnitus? Ringing in the ear. Have you ever heard that sound? But you only get it for a while, right? A few moments. Imagine that constant all day. Okay, so that with the vertigo, and then finally, the third is one or both ear hearing loss. So you have all 3, that's called Meniere's disease. So again, it's a chronic condition. This can lead to disability. Some people can manage it and then manage to hold a job, but most people with Meniere's, I mean, imagine, how can you go to work with these manifestations? Can you get anything done? No, go home, rest, right? So with vertigo again, you have all the vertigo alone is enough, right? Plus you have all 3. So you have the vertigo, the tinnitus, and then of course the 1 or 2 ear hearing loss. Management, there's no cure. You can treat it, but yeah, you can't be rid of Meniere's. So let's start with diet. Low sodium helps. That will keep the fluid in the ear normal or low. We've got glutamate as well, MSG, monosodium glutamate. So avoiding that will also help. And here are the complete. There's a chart again, 59-8. So this is specifically for Meniere's disease. So food high in sodium is not limited to canned or preserved foods. So teach the patient to read labels and then drink plenty of fluids. But what type of fluids? Anything that has no coffee, tea, or soft drinks. What do these things contain?
Caffeine.
Okay, so avoid caffeine basically. So what are encouraged? Water, milk, or low sugar drinks. Limit alcohol, again, MSG, I already mentioned. Okay. Drug-wise, patients may, because the endolymph really, which is the fluid inside the ear, is believed to be the cause of Meniere's, or at least exacerbates the symptoms of Meniere's. So treatment will include diuretics. And with diuretics, they cause hypokalemia, right? And avoid aspirin. Take note, what's that pink medication? Pepto, right? Pepto contains aspirin. Do you know that? Aspirin is in Pepto-Bismol. So that's included in the aspirin containing medications. Are we clear?
Yeah.
Pepto contains aspirin. So for the vertigo, we have a lot of options here to treat it. So Meclizine, I mentioned. So this is like for, the brand name is Antivert. It is over the counter. Tranquilizers, you need the prescription for this. So this is for Valium. For the nausea, you take antiemetics. Why suppositories? Okay, because by mouth won't help you, okay? Because you just vomit if you take anything by mouth. So just put it up your rectum, that will work. Diuretics again, thiazide, any type of diuretic can be prescribed by the physician. Surgery, again, the question won't be about the procedure, but what's the question on surgery about, ear surgery? Okay, pre and post-op, and we already had that, right? Page what? 1951, okay. That should be, yes, that should be it for. Do you take time to read the yellow pages, the nursing care plan? You don't? Well, actually the answers are here. Okay, so here, for instance, for vertigo, here are the interventions. Okay. I mean, some of them are mentioned in the chart, but this is more complete.
Okay.
So they're very specific.
That's the best.